Question number 1. The priority nursing intervention for a patient with acute pancreatitis is. The right option is option B. Maintain NPO status. Question number 2. A patient with peptic ulcer disease reports sudden sharp abdominal pain. The nurse should first. The right option is option D. Notify the doctor. Question number 3. The most important assessment before administering morphine in a patient with GI obstruction is. The right option is option C. Bowel sounds. Question number 4. For a patient with liver cirrhosis, the nurse should restrict. The right option is option A. Sodium. Question number 5. In a patient with ulcerative colitis, the most appropriate diet is. The right option is option B. Low residue. Question number 6. The best position for a patient with GERD is. The right option is option D. Head of bed elevated. Question number 7. The nurse monitors for which electrolyte imbalance in severe vomiting. The right option is option C. Hypokalemia. Question number 8. The priority goal in managing acute diarrhea is. The right option is option B. Maintaining hydration. Question number 9. Ascites in liver cirrhosis is mainly due to. The right option is option C. Low plasma proteins. Question number 10. A patient with suspected appendicitis should not receive. The right option is option D. Heat application. Question number 11. The best diagnostic test for confirming gallstones is. The right option is option C. Ultrasound. Question number 12. The nurse monitors for which sign after endoscopic esophageal varices treatment. The right option is option D. Bleeding. Question number 13. Which vitamin deficiency is common in chronic pancreatitis? The right option is option D. Fat-soluble vitamins. Question number 14. In GI obstruction, the most common symptom is. The right option is option B. Severe constipation. Question number 15. The most reliable indicator of improvement in a patient with dehydration due to diarrhea is. The right option is option D. Increased urine output. Question number 16. The priority concern in a patient with severe vomiting for 24 hours is. The right option is option A. Dehydration. Question number 17. In managing constipation, the nurse should first. The right option is option B, encourage fluid intake. Question number 18. The nurse expects which finding in a patient with gastric cancer? The right option is option A, early satiety. Question number 19. A patient receiving TPN must be monitored for. The right option is option A, hyperglycemia. Question number 20. The nurse should suspect perforated ulcer when the patient reports. The right option is option C, sudden severe abdominal pain. Question number 21. Which medication is commonly used to prevent hepatic encephalopathy? The right option is option D, lactulose. Question number 22. The priority nursing assessment before NG tube insertion is. The right option is option C, nasal patency. Question number 23. A patient with gastritis should avoid. The right option is option A, spicy foods. Question number 24. The most important lab test for suspected pancreatitis is. The right option is option D, lipase. Question number 25. The nurse expects clay colored stools in. The right option is option D, gallbladder obstruction. Question number 26. The nurse should teach a patient with celiac disease to avoid. The right option is option C, wheat. Question number 27. The priority nursing action during active GI bleeding is. The right option is option D, assess airway and breathing. Question number 28. Prolonged diarrhea may leads to. The right option is option B, metabolic acidosis. Question number 29. A patient with GI bleeding shows melena. This indicates bleeding from. The right option is option D, stomach or upper GI. Question number 30. The best initial management of severe vomiting is. The right option is option C, IV fluids.